Sickle cell disease is a rare genetic disorder that's associated with significant morbidity and early mortality. In folks that don't have sickle cell disease, our red blood cells move pretty flexibly through our blood vessels, allowing a smooth motion to carry oxygen to all the different parts of our body. But in sickle cell disease, the abnormal hemoglobin forms strands within the red blood cells, and that makes the red blood cells change shape, actually into a sickle or a C shape. Those cells are sticky and inflexible. And when you can't get blood through the blood vessels, you can't get oxygen to your whole body. And so sickle cell disease is really a condition that affects all organ systems and all parts of your body. The majority of people with sickle cell disease in the United States are Black or Hispanic, groups that are underserved in terms of their access to care both within and outside of the healthcare system.
In Michigan, we estimate that there are approximately 4,000 individuals in the state living with sickle cell disease. Since newborn screening started, we identify approximately 60 to 65 babies annually. And through the newborn screening program alone, we've identified about 2,200 babies. The partnership between Michigan Department of Health and Human Services and CHEAR, in terms of sickle cell, we collaborated on a planning grant to determine what sickle cell disease surveillance would look like in the state.
The Michigan Sickle Cell Data Collection Program is a population-based surveillance system which has multiple objectives, but really overall it's to identify everyone living with sickle cell disease in the state and follow them over time to understand opportunities to improve health outcomes and quality of life.
Data is important to the state because it drives recommendations that we put forth for our funders. It drives strategies and recommendations that we put forth to our legislators to provide us the necessary resources that we need to deliver and develop and design services and resources and programs for Michiganders.
What can we do is a question that we ask a lot in SCDC. Now that we have set up and implemented this public health surveillance system, we have a lot more data. Then we can start thinking about, okay, great. We know where the gap is. What do we do now? How can we work with clinicians? How can we work with the state? How can we work with our community-based organizations to start to close those gaps? And without having the baseline data to know where the gaps are, it's a little bit hard to close them.
Dr. Reeves has elevated Michigan to a national level in a different way with all of the good work and the many firsts that have come out of CHEAR, and Michigan being a real leader in helping develop a surveillance system that other states who are part of this process can model.
The commitment of the state to improving the lives of people living with sickle cell disease is just incredible, and we're very happy to play a role in supporting that in any way that we can.